All right, let's dive into the world of reconstructive surgery.
Okay.
Today, we're going to be exploring a technique that's changing the game for hernia repair.
Okay.
It's called the component separation technique, or CST.
Okay.
And you're probably wondering
Yeah.
what exactly is that?
Yeah.
Well, imagine surgeons being able to stretch and rearrange the muscles in your abdomen
Wow.
to fix those tricky hernias.
Okay.
We'll be dissecting a dense medical text to bring you the most fascinating parts of this innovative procedure.
It's truly remarkable how CST allows surgeons to essentially reshape the abdominal wall.
Yeah.
It's particularly effective for those large hernias that can't be fixed with simple stitches or a mesh patch alone.
And those large hernias are a bigger problem than many realize.
Right.
Studies show that incisional hernias, the ones that form at the site of a previous abdominal surgery,
Okay.
happen in a surprising 10 to 23% of patients.
Wow.
So if you or someone you know has had abdominal surgery, this is definitely something to be aware of.
Absolutely.
Yeah.
And the problem is compounded by the fact that traditional repair methods often fall short.
Right.
Simply stitching the hernia closed leads to high recurrence rates.
Yeah.
And while mesh can be effective,
Mm-hmm.
it brings a higher risk of infection.
So that's where CST comes in,
Okay.
offering a potential solution that minimizes the need for foreign materials like mesh.
I see.
But how does it actually work?
The key principle is expanding the abdominal wall's surface area to close the hernia without putting too much tension on the tissues.
Mm-hmm.
Surgeons achieve this by carefully separating and moving the muscle layers, almost like a tailor adjusting fabric
Right.
to make it fit perfectly.
That's a great way to visualize it.
Yeah.
But it's more than just stretching. There's a whole science behind it.
Right.
CST is based on 5 core principles that ensure both strength and functionality in the repair.
Exactly.
Okay.
The 5 principles are expanding the abdominal wall's surface area, carefully separating muscle layers for maximum expansion,
Yeah.
disconnecting muscle from its sheath for greater flexibility,
Oh.
using abdominal muscles for coverage, and employing bilateral mobilization for balanced strength.
Now, you might be wondering who exactly benefits from this technique.
Sure.
Well,
Okay.
as we mentioned earlier,
Yeah.
it's particularly effective for patients with large midline abdominal wall defects.
Okay.
Think of those hernias.
Yeah.
They're just too big or complex for conventional methods.
Right.
Yeah.
But while hernias are the primary focus,
Mhm.
CST can also be used to repair giant omphalocele,
Oh.
which is a birth defect where the intestines or other abdominal organs protrudes outside the belly button.
That's incredible.
Yeah.
Okay, so now that we have a good understanding of the problem and the potential solution, let's walk through what it actually looks like in the operating room.
First and foremost, the surgeon conducts a thorough preoperative assessment. They carefully examine the abdominal wall and review any imaging scans to get a complete picture of the patient's anatomy and the extent of the defect.
Right.
This is crucial for planning the surgery precisely.
So it's all about preparation and understanding the individual patient.
Yeah.
Like a tailor taking careful measurements before cutting the fabric.
Precisely.
Hmm.
Then the surgery itself begins.
Okay.
The surgeon makes an incision and carefully lifts the skin and underlying tissue away from the abdominal muscles,
Okay.
creating a clear view of the surgical field.
It's like peeling back a layer to reveal the intricate workings underneath.
Exactly.
Hmm.
Next, the surgeon makes precise incisions in the external oblique aponeurosis, a sheet of fibrous tissue that covers the abdominal muscles.
Okay.
Think of it as the outer layer of your abdominal fabric.
Okay.
This is where the actual separation of CST takes place.
So they're literally creating more fabric to work with.
Yes.
Interesting.
The surgeon then meticulously separates the different muscle layers.
Yep.
This is where knowing the specific muscle groups involved helps you understand the complexity.
Okay.
We're talking about the external oblique, internal oblique, and transversus abdominis muscles.
Okay.
By separating them, the surgeon gains that extra flexibility needed to close the hernia without excessive tension.
It's amazing how surgeons can manipulate these delicate structures with such precision.
Yeah.
What about those drains we often hear about after surgery? What's their purpose in a CST procedure?
Drains are a common part of many surgeries,
Hmm.
including CST.
Yeah.
They're strategically placed under the skin flaps and near the repaired area
Yep.
to prevent fluid buildup,
Right.
which could hinder healing and increase the risk of infection.
So it's all about keeping the surgical site clean and dry.
Exactly,
Uh.
to allow the body to heal properly.
Precisely.
Now, while the core principles of CST remain the same,
Mm-hmm.
there are some fascinating modifications to the technique that we'll explore next.
Okay. We just left off talking about drains and how they help with healing after a CST procedure.
Right.
But I'm really curious about some of the variations
Yeah.
you mentioned.
Mm-hmm.
It's fascinating how this technique can be adapted in different ways.
Yeah.
Let's start with endoscopic CST.
Okay.
I find it incredible that such a complex procedure can be done minimally invasively.
Yeah.
Can you walk us through how that works?
Endoscopic CST is truly a remarkable advancement. It allows surgeons to perform the muscle separation
Yeah.
using small incisions and a camera,
Okay.
leading to less scarring, less pain, and a faster recovery.
Mm.
Think of it as keyhole surgery
Oh,
for hernia repair.
that's an amazing visual.
Yeah.
But less scarring and faster recovery are just the tip of the iceberg, right? I've read that endoscopic CST might also have advantages when it comes to preserving those crucial nerves and blood vessels
Yeah.
in the abdominal wall.
Mm-hmm.
What can you tell us about that?
You're absolutely right. Minimizing disruption to the neurovascular supply is a top priority in any CST procedure. And endoscopic techniques have shown promise in this area. The smaller incisions and the magnified view offered by the endoscope can help surgeons avoid damaging those delicate structures, which in turn can reduce the risk of complications like muscle weakness, numbness.
So it's not just about aesthetics, it's
Right.
about preserving function
Exactly.
and ensuring the best possible outcome for the patient.
Yeah.
That makes a lot of sense.
Mm-hmm.
Now, while we're on the topic of variations and advancements,
Yeah.
I remember you mentioned that CST research is constantly pushing the boundaries.
Yeah.
What are some of the most exciting areas of research right now?
One area that's generating a lot of buzz is the development of new biomaterials for mesh reinforcement.
Okay.
While CST aims to minimize the use of foreign materials, sometimes a mesh patch is still needed to provide extra support, especially for large or recurrent hernias. Yeah. These new biomaterials are designed to be stronger, more compatible with the body, and less prone to infection.
That's fantastic.
Yeah.
It's like upgrading from a basic patch to a high-tech, body-friendly material.
Exactly.
What else is on the horizon for CST?
Another really exciting development is the use of robotics in CST.
Oh, wow.
Robotic surgery, which is becoming more and more common in various fields, allows for even greater precision and control during the procedure. This can potentially reduce trauma to the tissues, leading to faster healing and fewer complications.
Wow. It's incredible how technology is transforming surgery.
It is.
I'm always fascinated by how these advancements improve patient care.
Yeah.
What about personalized approaches to CST? I've heard that researchers are looking at ways to tailor the technique even more precisely to the individual patient.
Absolutely.
Yeah.
Personalized medicine is a key focus in many areas of healthcare, and CST is no exception. Researchers are investigating how factors like age, body mass index, and the specific characteristics of the hernia can be used to optimize the surgical approach for each patient.
It's like a surgeon crafting a custom-made garment.
Yeah.
Taking into account all the individual measurements and preferences to create the perfect fit. This level of customization is truly impressive.
It is.
Yeah.
And it speaks to the dedication and innovation within the field. Another area of active research that's worth mentioning is the ongoing effort to develop even less invasive approaches to CST.
Even less invasive than endoscopic CST.
I know.
It's hard to imagine.
Yeah. But surgeons and researchers are always striving to push the boundaries. These new approaches aim to further minimize scarring and recovery time, ultimately enhancing the patient experience and improving outcomes.
It sounds like the future of CST is incredibly bright, with constant innovation and a focus on patient well-being.
Absolutely.
But before we get too carried away with the future, I want to bring us back to the present and talk about some of the challenges that surgeons face when performing CST. One that comes to mind is the issue of abdominal wall atrophy.
Yeah.
What can you tell us about that?
Sure.
And how does it impact the procedure?
Abdominal wall atrophy, which basically means weakening or thinning of the abdominal muscles, can definitely pose a challenge in CST. It often occurs in patients who have had multiple abdominal surgeries or who have certain medical conditions. When the muscles are weak, they may not provide enough support for the repair, increasing the risk of recurrence.
So how do surgeons address this issue?
There are a few different strategies. In some cases, the surgeon might reinforce the weakened area with absorbable mesh, providing an extra layer of support to help the repair hold.
So even though CST aims to minimize the use of mesh, there are situations where it can play a valuable role.
Exactly. It's all about finding the right balance and choosing the approach that will provide the most durable and functional repair for the individual patient.
Makes sense. Now, another situation that I'm curious about is how CST is adapted for patients who have an ostomy. Can you explain what an ostomy is?
Sure.
And how the procedure needs to be modified in these cases?
An ostomy is a surgically created opening in the abdomen that allows waste to be diverted from the intestines to a bag outside the body. It's a life-saving procedure for people with certain bowel conditions or injuries. When a patient with an ostomy needs a hernia repair, the surgeon has to carefully plan the CST procedure to ensure that the ostomy continues to function properly afterward.
That sounds incredibly complex.
It can be.
I can imagine there are a lot of factors to consider. The surgeon needs to assess the location of the ostomy, the size and location of the hernia, and the overall condition of the abdominal wall to determine the best approach. They might need to modify the placement of the incisions or the way the muscle layers are separated to avoid disrupting the ostomy.
It really highlights the expertise and adaptability required of surgeons who perform CST.
You're absolutely right. It's a testament to their skill and their commitment to providing the best possible care for every patient.
This has been incredibly insightful. We've learned so much about the nuances and variations of CST. But one key aspect we haven't dived into yet is the debate about mesh placement. You mentioned earlier that there are different approaches, underlay and onlay. Can you break those down for us and explain the reasoning behind each one?
Of course. The debate about mesh placement is an ongoing discussion in the surgical community.
It essentially boils down to where the mesh is placed in relation to the abdominal muscles. And the underlay technique, the mesh is placed beneath the muscles, while in the onlay technique, it's placed on top. Each approach has its own set of pros and cons.
So let's start with the underlay technique. What are the advantages of placing the mesh under the muscles?
One of the main benefits of the underlay technique is that it creates a barrier between the abdominal contents and the mesh. This can potentially reduce the risk of adhesions, which are bands of scar tissue that can form between organs or tissues after surgery. Adhesions can sometimes cause pain or complications. So minimizing their formation is a desirable goal.
That makes a lot of sense. So the underlay technique is like creating a protective layer to shield the organs from the mesh.
Exactly.
What about the onlay technique?
Sure.
What are the advantages of placing the mesh on top of the muscles?
The main advantage of the onlay technique is that it can provide more direct support to the repaired area. This can potentially reduce the risk of hernia recurrence, which is a major concern for patients who have undergone this type of surgery.
So it's like reinforcing a weakened wall by adding an extra layer of support on the outside. Both techniques have their merits. But how do surgeons decide which one is best for a particular patient?
That's a great question. And the answer is that it depends on a variety of factors, including the size and location of the hernia, the patient's individual characteristics, such as their age and overall health, and the surgeon's preference and experience.
So it's a personalized decision, just like many other aspects of CST.
Exactly. The surgeon will carefully weigh the pros and cons of each approach and discuss the options with the patient to make a shared decision. That aligns with the patient's goals and needs.
That's reassuring to know. It's all about finding the best approach for each individual case. Now, I want to shift our focus to a topic that I know is on many people's minds when they're considering any surgery, the potential complications. We've touched on this briefly throughout our deep dive, But I think it's worth revisiting in a bit more detail as we wrap up this part of the episode.
I agree.
Okay.
It's important to have a realistic understanding of the potential risks and benefits of any medical procedure, and CST is no exception.
Yeah.
While CST offers promising results and has significantly improved the lives of many patients, it's crucial to be aware of the potential complications.
So let's talk about those complications.
Okay.
What are some of the things that patients should be aware of?
The most common complication associated with CST, as with any surgery that involves an incision, is wound infection.
Right. Infection's always a concern. But thankfully, there are ways to minimize the risk.
Yeah.
Through proper sterile techniques and postoperative care.
Absolutely. Surgeons and their teams take great care to maintain a sterile environment during surgery.
Right.
And they provide patients with detailed instructions on how to care for their incisions after the procedure to prevent infection.
Right.
But even with the best precautions, infections can still occur.
What about other complications besides infections?
Sure.
What else should patients be aware of?
Other potential complications include seromas, hematomas, and skin necrosis.
Okay.
A seroma is a collection of fluid that can develop under the skin or in a body cavity after surgery.
Okay.
A hematoma is a collection of blood outside of a blood vessel.
Right.
Essentially a bruise.
Okay.
And skin necrosis, which is less common but more serious, refers to the death of skin tissue.
Oh, wow.
Which can happen if the blood supply to the area is compromised.
These complications sound concerning, but how common are they?
Thankfully, serious complications are relatively rare with CST.
Okay.
Wound infections are the most frequent, but even those occur in a relatively small percentage of patients.
Okay.
The other complications we discussed are less common.
Right.
It's important to remember that every patient is unique.
Yeah.
And the likelihood of complications can vary.
Right.
Depending on individual factors like age, overall health, smoking history, and the complexity of the hernia.
So while it's essential to be aware of the potential risks, it's also reassuring to know that the vast majority of patients have positive outcomes after CST.
Exactly. CST has revolutionized the way we approach complex abdominal wall defects, offering a safe and effective option for many patients who previously had limited treatment choices.
Speaking of positive outcomes, I'm eager to hear about the recovery process after CST.
Sure.
What can patients expect?
Okay.
And what steps can they take to ensure a smooth recovery?
Recovery after CST varies depending on the individual patient and the complexity of the procedure.
Okay.
But in general, patients can expect some pain and discomfort for the first few weeks, which can be managed with medication prescribed by their surgeon.
Pain management is crucial for a comfortable recovery.
It is.
What else can patients do to help themselves heal?
Rest is essential.
Okay.
In the early stages of recovery, patients need to avoid strenuous activities and heavy lifting to allow the repaired area to heal properly. But that doesn't mean they have to be completely inactive. Walking and other gentle exercises are encouraged as tolerated to promote blood flow and prevent complications.
So it's about finding a balance between rest and gradual resumption of activity.
Exactly.
Okay.
And of course, it's crucial to keep the incision clean and dry to prevent infection. Your surgeon will provide you with specific instructions on how to care for your incision, including how to clean it and what types of dressings to use.
Basic hygiene goes a long way in promoting healing.
It does.
What about follow-up appointments?
Sure.
How often do patients need to see their surgeon after CST?
Patients will have follow-up appointments with their surgeon to monitor their progress and ensure everything is healing as expected. The frequency of these appointments varies depending on the individual case. But generally, patients will see their surgeon a few times in the first few months after surgery. And then less frequently as they continue to heal.
Regular checkups are essential for catching any potential issues early on?
Absolutely.
What will the surgeon be looking for at these follow-ups?
The surgeon will check the incision for signs of infection, assess the strength of the repair, and answer any questions the patient may have.
It's all about open communication and working together.
It is.
To ensure the best possible outcome.
Right.
This has been incredibly informative. We've covered so much ground in this part of our deep dive.
We have.
From the intricacies of endoscopic and robotic surgery to the challenges of abdominal wall atrophy and ostomy considerations. I'm feeling much more knowledgeable about the nuances of CST and the factors that influence its success.
Me too.
Yeah.
It's been a great discussion.
Yeah.
And I hope our listeners are finding it helpful as well.
I'm sure they are.
I hope so.
We'll be back with the final part of our deep dive into the fascinating world of component separation technique after a quick break.
Okay.
Don't go anywhere.
Welcome back.
Okay.
Before we wrap up our deep dive into component separation technique, we have one more fascinating aspect to explore.
Okay.
Outcomes. I think it's important for us to understand how effective CST really is.
Yeah.
And how it compares to other hernia repair methods.
Sure.
What can you tell us about that?
You're right.
Yeah.
That's a crucial aspect to consider.
Mm-hmm.
The good news is that CST has shown very promising results, particularly when it comes to those challenging large hernias that we've been talking about.
I'm always curious about real-world examples.
Yeah.
Are there any specific cases where CST achieved exceptional outcomes that you can share with us?
Absolutely.
You know, stories that really highlight the transformative power of this technique.
One case that stands out involved a patient who had a very large recurrent hernia.
Mm-hmm.
They had undergone multiple previous repairs using traditional methods.
Right.
But unfortunately, the hernia kept coming back.
Oh, wow.
It was causing them significant pain and impacting their quality of life.
Right.
They were understandably hesitant to undergo another surgery, but they were desperate for a solution.
I can only imagine how frustrating that must have been for them.
Yeah.
It sounds like they were at their wits' end.
They were.
Yeah.
But fortunately, they were referred to a surgeon who specialized in CST. The surgeon carefully assessed their case
and determined that CST would be a good option.
Right.
The surgery was successful.
Right.
And the patient experienced a remarkable recovery.
Wow.
The hernia didn't recur.
That's fantastic.
And they were finally able to live a pain-free life.
That's an incredible story.
Yeah.
It really highlights the hope that CST offers to patients who have struggled with recurrent hernias.
Absolutely.
It's truly inspiring to hear about these positive outcomes.
It is.
But I know that no medical procedure is without its risks.
Right.
We've talked about the potential complications of CST.
Yeah.
And I think it's important to address those again as we wrap up our discussion.
I agree.
So let's revisit those potential complications one last time.
Okay.
Just to make sure our listeners have a clear understanding of what to expect.
As we discussed earlier, the most common complication is wound infection.
Right. Which, as you pointed out, is a risk with any surgery that involves an incision.
Exactly.
Surgeons take many precautions to prevent infections.
I do.
But they can still occur.
Right.
Other potential complications include seromas, hematomas, and skin necrosis.
Yeah.
Though these are less frequent.
They are.
It's important to emphasize that the vast majority of patients do not experience these complications.
Right.
But it's essential to be aware of them.
Yeah.
And to report any unusual symptoms to your surgeon immediately.
Absolutely.
Right. Open communication with your healthcare provider is key.
It is.
Now, I want to shift gears for a moment.
Okay.
And talk about the future of CST.
Sure.
What exciting advancements are on the horizon that could further improve outcomes and minimize risks?
That's a great question.
Yeah.
One area that holds a lot of promise is the continued development of minimally invasive techniques.
Right.
We've already discussed endoscopic CST, but research is ongoing to refine these techniques and make them even less invasive. Imagine a future where complex hernia repairs can be done with just a few tiny incisions, leading to faster recovery times and reduced risk of complications.
That sounds almost like science fiction.
I know.
But knowing how rapidly technology advances in medicine, it wouldn't surprise me if that became a reality sooner than we think.
I agree.
What other innovations are researchers exploring?
Another exciting area of research is the development of new biomaterials for mesh reinforcement. As we discussed earlier, mesh can be a valuable tool in certain CST cases. But there's always room for improvement when it comes to materials science. Researchers are working on creating mesh materials that are even stronger, more biocompatible, and less prone to infection.
It's amazing to think about the possibilities.
It is.
It seems like the future of CST is incredibly bright.
It is.
With ongoing innovation and a commitment to providing the best possible care for patients.
Absolutely.
As we wrap up our deep dive, I want to leave our listeners with something to ponder.
Sure.
We've learned so much about the technical aspects of CST,
Right.
but it's also important to consider the broader implications of this technique.
Yeah.
As CST becomes more widely adopted
Mm-hmm.
and its capabilities expand,
Yeah.
what ethical considerations might arise?
That's a good point.
Think about the potential impact on healthcare access costs and decision-making.
Right.
These are complex questions
Yes, they are.
that deserve thoughtful discussion
Yeah.
as this field continues to advance.
Those are excellent points to consider.
Yeah.
Technology and medicine are constantly evolving.
Right.
And it's our responsibility to engage in these important conversations and ensure that advancements are made ethically and with the patient's best interests at heart.
Well said.
Thanks.
This deep dive has certainly given us all a lot to think about.
It has.
I want to thank you for sharing your expertise with us.
It's been my pleasure.
And for helping us navigate the complex world of component separation technique.
Yeah.
It's been an enlightening journey.
It has.
And to our listeners, we encourage you to continue your own exploration of CST.
Okay.
And other advancements in hernia repair. Knowledge is power.
It is.
And we believe that everyone deserves access to clear, accurate, and engaging information about their health.
I agree.
We hope this deep dive has empowered you to ask questions, make informed decisions, and advocate for your own well-being.
Absolutely.
Thanks for joining us on this journey of discovery. Until next time,
Okay.
stay curious, stay informed, and stay healthy.